I could feel my AFib, and I'd been told that not everyone can, but I could. And it just felt like my heart was jumping out of my chest irregularly. And at the time, before I was put on medication, my heart rate accelerated very rapidly, and very uncomfortable. I was very anxious, and when it first started, actually frightened. And I would take myself off to the ER every time it happened. But the other was the side effect of the medication. Slowed my heart rate down significantly. So I was chronically tired. I finally decided to do something when it was interfering with just my life, and it was bothering my wife also, because we were afraid to go on vacations. We were afraid, that I was exerting myself too much, even in the yard, doing yard work. And it was actually quite a lot of stress on my wife also. And I think I just decided that, although I didn't know that something had to be done. I attended a seminar on ablation, but it was the burning type, and got the name of the doctor and actually had a procedure scheduled. And then I changed jobs and changed insurance, so I put it off. And it wasn't until, I think, a couple years later that my sister-in-law, who's a nurse, heard about the seminar with this procedure, the cryoballoon. So I went, and that's when I really felt comfortable with the way it was explained. Is when I really felt comfortable with having it done. The doctor that I went to kept using the adjective elegant, and I liked that, and it just seemed elegant, And I said to myself, "Gee, why hasn't this been done before? This just makes sense." I went in late morning, was prepped. Had the procedure that afternoon. I did an overnight in the hospital and was out by the next afternoon. It was very simple. The only pain I ever had was a headache from missing 2 days of coffee. I feel very good. I have not had an episode since the procedure. In the healing period, a few months afterwards, there was a slight arrhythmia, but it was qualitatively different than what had happened before. It was very brief, for one thing, 10, 15 minutes, and it just felt a little different. But really, since a month or two afterwards, nothing, absolutely nothing. I feel very hopeful. Now, I know that there's always a possibility that some form of arrhythmia will return, or could return. And I know that as I get older. But, the way it was before was just miserable. It just, even if it wasn't literally a danger, which, as I got older, it would have become more of a danger of something happening. But even if it wasn't a real danger, it was just, psychologically, it was just a big burden. That I had this thing that I couldn't, if I was out too late, or we were on vacation, or away from home, that my heart would go into an arrhythmia. And my wife has noticed the more energy, so I'm doing a lot more. I've done a lot more projects around the house. My yard really does look great.